We want the full continuum of care across ambulatory into the acute space and have the one pane of glass. So that's what we're doing. Let's identify what's going to be best for the organization. Let's talk to the providers, show them the two systems, and then, what is the 5-year cost of this thing? So we built all of that into our strategic plan in terms of giving us a firm foundation in an EHR that could take us for the next 15 years, at least. I was looking at Becker's, and there was an article in terms of the implementation cost. They identified an article where there were, okay, we're just going to show you the cost of these 4 implementations, right? Which was great. The importance of understanding costs for a CIO and a CFO and a CEO to go forward in terms of, okay, so we serve an underserved community, which means we don't have a lot of money. But if we choose appropriately, we can get a lot from those systems that we do choose. So we did a partnership with KP, Kaiser Permanente, which is Epic. Our partnership was to offload their COVID population. But one of the things Kaiser wanted is to make sure that the information that they were generating on, because those are their patients, their information in terms of overall, I want that continuum of record of what you at Emanate did for our patient while he stayed or she stayed. So we set up direct messaging where we sent CCDAs to KP direct address, which they then triaged on their end and absorbed the record into Epic. So they had a continuum of care picture of what happened, and because it's a CCDA and it's discrete data, they're able to populate it directly into Epic. I remember the first one we sent across, and the physician on the other side, she's like, oh, this was great. I got everything I need. So what we built with professional services was an agreement in terms of saying, okay, this is our issue. Ultimately doing patient tracking of interactions on the units before the patient has been tested at that time initially was, wow, okay, now they've converted and they're positive, who's been in the room? And what was going on with our infection control nurse is she was doing everything by hand, talking to the nurse manager on the floor and saying, who was on that day? And then all of a sudden it was, well, who from AVS was in their room? Was there security on the floor because there was an issue with that patient? So all the contact points got really, it just went like this and mushroomed in terms of, how are you going to track all that? We brainstormed with MEDITECH and said, these are all the data elements that we've got. What do you think in terms of being able to capture the interaction in the patient room? In MEDITECH, you have all the logs in terms of who logged onto this patient's record at any time. And also leverage that in BCA as another data source to say, these are all the people that were scheduled and on the floors. So our infection control nurse, she was just out of her mind after we got it running, and in 3 minutes, bang, BCA dashboard, here you go. These are all the interactions. So we have these great EHRs, great data sets across the hospital, but that's data. That's not information, right? We need to be able to understand what the problem is and then take all the data and turn it into information that's usable. And that's exactly what digital health is to sort of say, we're going to manage this disease, even though it was COVID tracking, we could also do it with surveillance. So it goes back to our strategic vision was, okay, we're going to buy Expanse, but this is just the foundation. Now we want to take it forward and leverage what we've purchased. Yeah, we're doing all the ambulatories, the new acquisitions, and rolling it out more and more and more. But we're also doing the day-to-day activities in terms of how can we leverage the technology for other things that we do. Using point of care from MEDITECH for the nurse. So, right now, I want to scan meds. I've got a handheld for scanner that's attached to a WOW. I've got the SpectraLink, and then, oh, by the way, I also have my cell phone because, I'm carrying that because the doctor's going to text me on that. Now I can give you one device that's a smart device that has Expanse point of care. It has a nurse call system. All of the apps are there, right there on the phone for the nurse. So lots of opportunity there in terms of apps on those devices. The opportunity there is to try to make it as best for them as possible. The job is to take care of the patient. And it's so important to make sure that we're clearing that way. And the partnership with MEDITECH will do that.